So, hello everyone. Thanks for joining us today for this inaugural event for the AgeTech startup community in Canada. I'm really excited today to give you an opportunity to hear from some great speakers and some really good content. But before we get things started, I'd first like to introduce you to Maria Ponte of Startup Canada to provide us with some opening remarks.
Thank you so much, Michael. As Michael said, I'm Maria Ponte. I'm Program and Communities Manager of Startup Canada. We are located in Ottawa, next to Parliament Hill, but we have communities across Canada. Since COVID hit in March, we have had conversations with entrepreneurs across Canada, and we have asked how can we support them? What can we layer in our agenda to support them right now? And feedback number one was definitely more activities to connect entrepreneurs, to elicit knowledge transfer. And that's exactly what community mixers are. To provide just a bit of context of what Startup Canada is for those that are not familiar with our organization, we support entrepreneurs across Canada, and we have a heavy focus on three groups of entrepreneurs: women entrepreneurs making social impact, and entrepreneurs going global or aiming to go global. So this is a very special event for us because, as well, through the pandemic, we have realized that there's lack of targeted support in the community building space. And even though we have a lot of communities location-based, this is our first community based on a certain industry. So it's very important for us, and hopefully the first of many. And today we felt truly honored to be for our partnership with AgeWell, that, like us, connect entrepreneurs, elicit knowledge transfer, of course, in the sector of AgeTech, that it's so important, so fundamental in our society. And we are very excited as well, and hopefully the first of many events with AgeWell. I want to very special thanks to Michael for the opportunity of this partnership, for making possible this event. And well, thank you so much. Very excited to be here, and back to you, Michael.
Thanks, Maria. Likewise, at AgeWell, we're really excited. We were excited when the opportunity came up and to hear about this initiative to start these communities. We try to work and support with innovators in AgeTech and really developing innovations that benefit older adults. And the idea of finding a way to bring a community of entrepreneurs, startups, and overall innovators together to raise awareness of what they're doing and also to help support them is right up our alley. So we're really excited to be working with you on that. I guess what I'd like to do first, briefly for all of you, is to give you a little bit of an introduction to AgeWell. It'll be quite brief, and then we'll move on to, I guess, what you're all here for the first hour, and that's chatting with Rakuten Kobo CEO, Michael Tamblyn, who will be giving you some great insights. So first of all, to introduce myself, my name is Michael Krastowski, and I'm AgeWell's Business Development and Industry Relations Manager. And I am someone who works with innovators, startups, and our researchers, helping them with commercialization, as well as with AgeWell partners, helping connect them with startups and innovators in this space. So I will just run through these slides, which I hope you can all see, quickly showing you a little bit about AgeWell. To set some context, we did a survey through Environics last year, and we repeated it this year as well, showing similar and even more encouraging results that indicate that older adults are actually usually quite confident using current technology. They also believe that it can help them in numerous ways. However, we see that sometimes only 2 in 10 may use an important form of technology, for example, tech for health and wellness. And so we want to kind of close that gap. And the way to do that is to work in supporting entrepreneurs and startups in this space to ensure that they're developing solutions that are going to be adopted by older adults. So in terms of AgeWell, we are a pan-Canadian network. We've been around for over 5 years, and we are federally funded. And we support innovation and technology benefiting older adults. We funded over 100 projects over the last 5 years, developing over 118 solutions that obviously include technology, but also policies and services that make those technologies possible in terms of implementing them. I work with over 40 post-secondary institutions, over 250 researchers, and over 760 highly qualified personnel. These numbers are always changing, so I have here listed 40 startups that we work with through our startup affiliate program. The number is actually closer to 45 now. And we also have national innovation hubs that cover things like policy, digital health, big data in age tech. And most recently, one is being launched on technology adoption in northern communities. And of course, most importantly, AgeWell is all about including older adults and caregivers in what we do. So over 4,700 have engaged with us in the work we've supported. AgeWell looks at everything through 8 key challenge areas that we developed by canvassing over 1,000 people across Canada a couple of years ago. I won't go over all of them, but suffice to say that most of these you'll probably be familiar with in a sense in terms of what you're developing. And we found that these are key areas we need to move the needle on to improve life for older adults. So we've supported innovation in a number of ways, obviously research at early stages, but going throughout the pipeline all the way to commercialized research through startups. And this kind of covers all the different areas you may think of when it comes to impacting life for a caregiver, an older adult, whether it's in clinical settings or at home, helping people stay healthy, connected, and more. So really a lot of what we do is made possible through our partnerships, much like the partnership here with Startup Canada. So AgeWell has over 420 partners, and that spans industry, academia, not-for-profit sector, government, as well as various community and other partners. Some example partnerships we list here. Some are obvious, in the senior living sector. Also, more recently, we're developing more partnerships in those who are investing in startups. And of course, we also have partnerships in the technology space and those who are interested in serving and improving life for older adults. And that includes, for example, Best Buy through Best Buy Health, and of course, Rakuten Kobo. An example of how we work with partners and startups is we try to find ways to help validate developments and products that are coming out of startups or researchers. And we work with our partners to make that happen. An example here is specific to long-term care or the senior living space, where we either may have funded research or made connections for startups to help them validate or potentially make changes to their product when it comes to actually working with end users and learning that maybe there's a different way they could approach what they're doing. So I just wanted to briefly say, as I close this out, we're really excited about starting this community. What we're going to try to do is really support you and find ways to create activities that will be beneficial to you. Our aim will be to hold about every month some kind of webinar or event that will either give you knowledge or access to resources or people that will help you grow and make your businesses a success and get your innovations out there into the real world. As AgeWell, our mandate is all about making sure there is a real world impact for older adults and caregivers. I've listed some that we'll be looking to plan in no particular order. And one of these types of events is obviously this launch, but also the second part of it in the second hour, where we will talk about entering a different marketplace and getting some key opinion leaders and those making important decisions on supporting innovation in age tech in the UK, but also in healthcare. So those are the kinds of events we'll likely put together for you, including investors coming on board for some events and doing things like how to adopt or increase adoption and implementation of technology through different partners in our network. So we'll look forward to putting together other events with Startup Canada as well, of course, but just some ideas here to give you a sense of what we'll look to put forward for you in the coming year and beyond. So with that said, we do have a Slack channel for AgeWell startup affiliates that will open to the community. And what we'll look to do is to have you always submit questions to the community. A lot of the more mature startups are often willing to provide answers and let you learn from their own experiences. And of course, at AgeWell, we'll be doing the same. We'll find ways to make this happen, obviously through Slack, but also, as questions come in different ways, we might find a monthly or regular way to share some FAQs or answers for you to help you learn from them. So now what I'd like to do is to uh, help introduce our speaker, our first speaker here, and that is Michael Tamblyn, who is the CEO and founder of Rakuten Kobo. Michael Tamblyn has also been working with AgeWell for quite some time at this point as the chief entrepreneur for AgeWell, providing support, insights, and advice to startups and entrepreneurs in this space. And I'm sure you'll all benefit greatly from the work and the insights that he's able to provide and share with you. I'm sure a lot of you, or all of you, are probably familiar with Rakuten Kobo. It was a great success story in terms of a Canadian startup, and Michael's obviously an integral part of making that happen. At this point, they have sales throughout the world, and they're obviously a company that's worked closely with older adults and developing technology for them. So Michael may have more to say on that. And at this point, I'd like to hand it over to him.
Thanks so much, Michael. Yeah, just to give people a quick sense of Kobo and who we are, and it'll be very short. We started in late 2009, early 2010, a very small group in Toronto. Fast forward 10 years, we're now about 500 people operating in 25 countries. We have about 38 million users right now, and operate both as a seller of ebooks. So we sell ebooks and audiobooks, and also as a manufacturer and designer of e-readers. So we're very much in this place of being passionate about reading. We love bringing technology to people who have books as kind of the recreation that's in the center of their lives, and along the way, that's kind of collided us with issues around accessibility and working with older adults, because when we first went out into the market, we kind of assumed that the people who would be doing e-reading, who would be reading ebooks, would be the kind of classic technology early adopter, the 20-year-old, 30-year-old. And then it turned out that a lot of our customers were 50, 60, 70, 80, drawn to digital reading because of the benefits of accessibility that came to us. So we kind of accidentally had to become familiar with the kinds of benefits and barriers that people would encounter as older adults as they started to use our technology. And then that became more and more of a practice as we went on, and now is kind of baked into what we do. But that got me involved with AgeWell, and now that has me working with startups who are looking at the kind of intersection of aging and technology, which is why I'm here. And so I'll pass it back to Michael, and we can take this in a bunch of different ways. So let's get into it.
Okay, great. So we have thought about some questions that I think would be great for the audience to hear answers to from Michael. So while we do go over those, please feel free to submit any questions you may have for Michael in the Q&A slot or in the chat, and I will pass this on to him, and we can all benefit from the answers to those. So, please feel free to do that at any time. And at this point, I'll just start with the first question here. And this is something that we come across quite often with startups. And that's the fact that many older adults are going to describe the challenge of adopting some solutions that were thought of and maybe were great ideas, but they're developed by people in their 20s and 30s. And sometimes they may somewhat miss the mark. So you alluded to this in your remarks, but given that Kobo has a strong older user base, how do you obtain feedback and input from older users that kind of helps you develop your products and make changes?
Yeah, thank you. That's a great question. Like I said, we found out almost after the fact that we had older adults as a significant part of our user base, and it took us a while to figure out just how significant a segment of customers that was for us. And so once we discovered that we actually have, we have as many, we have more 60-year-olds than we have 30-year-olds, and we have as many 70-year-olds as we have 20-year-olds. That meant that we had to start building some actual feedback mechanisms into how we develop technology and product so that we could take some of those requirements into account. And so that started very kind of primitively with some focus groups bringing in older adults into the early parts of both the usability testing process for us and user acceptance testing process, but now is fairly robust. So we have an always on focus group called the Kobo Insiders. So these are customers that we've had for a long time who, because we give them cool stuff and early access to products, they're kind of always available to us if we need to ask a quick question or show a prototype or gauge a reaction to a potential new feature. And so that's a demographically representative group. So that has people from our older adult audience in it. But we're also aware that group becomes trained over time. So, they're already kind of fans and they're already friends of ours. So we know we're not necessarily going to get unvarnished opinions from them every time, but it's good for a quick hit. So we also, we bring our designers and UX teams both into environments where they can engage directly with older adults. We've taken them to long-term care, we've taken them to retirement homes, and had them run usability tests there with people who had never encountered our technology before. And so then they're getting pure, unvarnished feedback to things like, hey, how would you set this device up? Show me how you would find a book using our app. And then they're able to directly see the kinds of hurdles that people run into. We also use our customer service as a feedback mechanism. So we're looking at the kinds of questions that bubble up as people engage with the service, and that feeds into the product development cycle. And then there's also kind of a general, take things home, ask your parents, ask your grandparents, that we've gotten people to become more comfortable with, of realizing that a lot of the people that they're building their products for, aren't their friends or, their partners or their spouses, but are more likely to be their parents or grandparents. So, so to the extent that they're willing, use them as guinea pigs sometimes as we're trying stuff out. And then we'll occasionally bring in consultants too when we're looking at specific areas of usability or accessibility where we really want to make sure that we're kind of taking best in class, state-of-the-art understanding of how to overcome some of those hurdles.
Yeah, and that's great. Maybe a follow-up to that then is, do you still find your team is surprised by some of the feedback that comes back that way, especially when it's unvarnished and from new groups?
Oh yeah, I think one of the great things about that kind of engagement is that it helps people to kind of build their, I don't know what you call it. I think we try to prioritize this idea of putting ourselves in the user's shoes, but unless you're there with someone who is trying to hook up a device to Wi-Fi, and you realize that they can't read the 32 character password that's printed on the back of their Wi-Fi router, and you have to find a way to help them do that. There's nothing like that real world feedback to help give people a sense of, okay, these are, there are barriers here that I can't overcome by just making the type bigger. And then they have to start thinking creatively about that.
Mm-hmm. Yeah, and I know obviously, some of the entrepreneurs or startups here may think, or we've heard before, it's difficult for me to get a significant amount of feedback from older users, and how do I do that? So, I mean, I don't know if you overcame that in a specific way early on. I mean, I know I can speak to AgeWell, but I wonder if you have any kind of experiences with that.
I actually found that the bigger barrier is, getting people over that that personal barrier of being nervous around older adults. There's a lot of reticence around, well, what are we going to talk about? How are we going to do this? Like, what if they don't understand what I'm trying to say? That goes away with repeated exposure. And so, yeah, some of it is about outreach and either finding customers who are representative of that particular demographic, or building relationships with particular organizations or groups or institutions where you can get access to that customer. But so much of it is just being okay with sitting down with someone who may not know your technology or may not be the same age as you, and feeling comfortable asking them some questions and getting into a bit of a dialogue. And it's like that, the shy UX designer is a far bigger barrier in a lot of cases than the lack of access to older people. There are older people all over the place. They're all around. Like, this is not this is not a scarce resource, but that willingness to just kind of open yourself up to whatever that experience is going to be is something that people have to be okay with.
Yeah, no, that's great. That's a good point that's not always made. It's the other side of it, because I think there are ways and resources to help connect you with older people as well. I know we try to provide those, and we'll look to do that with this community. But yeah, it goes both ways, and there's a lot of great insight you can gain, but you have to be willing and comfortable with getting out there and doing it for sure. So somewhat kind of building off the focus we put here on getting input from older people. I'm thinking about how some startups are obviously looking at the space, and obviously those in attendance here are interested in developing solutions for older adults, but sometimes your product serves different segments. So I wonder, when you have a product, like you do, that has universal appeal, how do you balance meeting the needs of a specific segment, such as older readers, with other customer segments? Maybe it's not an issue, but if it is, I'm wondering how you balance that out.
Oh, it's a constant challenge. And yeah, it's different if you are, if you're building, assistive technologies, or you're building mobility technologies, where like that is your sole customer and your sole product focus, then prioritization becomes really easy. For someone like us, where we've got millions of customers, some of them are older, some of them aren't. And usually our roadmap is pretty unsentimental. What helps the most users wins, what's going to make the best reading experience overall. And that's going to turn into the most ebook sales or the most e-reader sales wins. But then there are going to be some things that remove barriers or unlock access to a group that that if you were just doing it on a dollars and cents and user impact basis, wouldn't win in that prioritization. And so, I would say we got caught early on just doing math on revenues and users, and that created pockets of the user experience that just weren't very accessible. So now we have a component of our strategic roadmap on diversity, equity, and inclusion that is a strategic priority. So that has both a pool of resources and a pool of budget to it that can then be a forcing function for things that can solve an accessibility issue, and that can or that can break a barrier, or that can add an assistive technology. And so that's been really interesting, because it's then created features that are differentiators for us in a very competitive space that that we can then market on. And so the thing that would never have won on pure revenue math ends up being something that we get to use to showcase how we are different than some of our competition, and that helps us sell more anyway. So it works out well regardless.
That's interesting. So I guess maybe to follow up a little bit on that, especially as you mentioned how you look at this strategically, I wonder if you'd be able to speak to the diversity within the older adult market from your perspective. I mean, a lot of times people look at older adults almost as a monolith, and you kind of, if you understand one, you may understand them all. I wonder how you may look at diversity within that segment.
Yeah, it's probably the thing that most entrepreneurs entering into this space get tripped up on, is that notion of treating older adults like a monolith. And this is a world of edge conditions and people that sort of either sometimes fit into the target market that you're going after and sometimes don't, or may swing in and out of it depending on ability or capability. And so that's one dimension of diversity. Another for us, like looking at the kind of what I call like the classic definition of diversity, is that we see a great deal of difference in background, people coming from different cultures, who are all still within that age demographic, and figuring out how do we incorporate all of those different viewpoints into what we're doing as well. We have the additional dimension as an international company of the different ways that aging manifests in local markets across a lot of different territories too. So all of that makes it makes it pretty interesting. But even just looking at Canada for a minute, one of the most interesting aspects of diversity for us in the context of older adults is the number of people who have come from other countries and are doing their aging here in Canada. So what that's leading to for us, for example, is people who are wanting to read books from their home language, their home country in Canada, and us being able to make sure that those books across, I think now like 68 or 70 different languages, are available in Canada, and then doing all of the accessibility work to make sure that those books are readable, legible, accessible for people in those territories at the same time. So it's kind of a compounding set of complexities that we start to deal with, but it's a super fascinating space.
Yeah, no, I can definitely imagine the, in some ways, added challenge, but I would expect that by addressing that over time, you obviously distance yourself from competitors or increase the success of your business, as opposed to just trying to make a one-size-fits-all approach work. So that's
and generally when we do that, all users tend to benefit. Like when we crack an area of accessibility or just general ease of use, that generally doesn't just benefit one particular segment. That tends to make it easier for everyone to get on board, whether they are dealing, for example, with issues of sight ability because of macular degeneration due to older age, or because they have another kind of congenital vision-related impairment. It's still going to help them, and so every time we make the experience better, we tend to see a lot of second-order benefits that come to us as well.
And we actually have an interesting question from the audience here, and that's it's from Aaron, and he's asking, do you get employment requests from older adults asking to join your software developer team? And is it generally the case that people with similar needs, eyesight, dexterity, develop the best solution for those needs?
So to the first question, do we get employment requests from older adults asking to join the software development team? We do, and one of the priorities that we've been building into our hiring practices when we're looking at things like diverse hiring is not just looking at what I'd say are kind of the more obvious dimensions of race and ethnic background, but also looking at age as one of the dimensions of diversity that we want to make sure don't have any barriers in our hiring process. And that's because we want those perspectives inside the organization. And we know that there's a lot of talent and experience out there that we can get access to, and frankly are especially aware that in the technology community, the dimension of age is as or more likely to be a source of discrimination as racial background. And so it's that's something that we really want to make sure all the way through our hiring funnel we haven't that we haven't unintentionally created any barriers to hiring somebody to be able to bring us some of that valuable experience. As to the second part of the question, do we feel that that those solutions are best developed by the people who themselves are experiencing those barriers? I would say I don't have a big enough sample set to say, at least for ourselves. So we do, for example, have people working on issues related to sight and vision who are themselves not possessing of those disabilities, but they seem to be producing, at least from what our feedback tells us, very good solutions to those issues. But I think most importantly, it's that they have frequent engagement and contact with those communities to see whether or not those solutions are landing well. And obviously, it's great to have as much access to people who have that lived experience as we possibly can, whether inside as an employee, outside as a customer, or somebody who's been brought in to provide us with feedback or user experience.
Yeah, that's great. And thanks for that question, Aaron. Everyone else, feel free to submit any.
Yeah, come on, more questions. Bring it.
I guess I want to switch gears a little bit to look at the startups and the challenges they face, maybe more generally in some respects, but also relevant to this market. So many entrepreneurs that do look to serve older adults, they tend to enter a space where they may have to partner with larger players, for example, in senior living or home healthcare. I wonder if you have any advice on how to plan for this at the early stages, like when it comes to building partnerships with obviously organizations or companies that are much bigger than you are at that stage. Do you have any ideas you can share for that at the early stages, or when solutions are already ready, or at any point?
Yeah, what I would generally say is that that it's important to become really familiar with the mechanisms of B2B markets and institutional adoption if you decide that you're going after a product that is going to end up engaging with its users through those partnerships, like with senior living or with home healthcare. And I think what's especially challenging about it is that a lot of what we now see as the standard startup playbook of agile development, minimum viable product, all becomes a lot harder in the B2B space and in the institutional space, because institutional buyers are just kind of less receptive to agile MVP solutions. They want to buy something that works, they're expecting things to be sort of fully featured and fully thought out. They're used to dealing with and engaging with larger technology companies who are rolling in with a disciplined sales process. And so all of that kind of initial barrier to pitch, to sell, becomes a lot harder. So I think one of the most important things to look at when you're going after a problem that's going to be delivered through those channels is looking at the question of adoption. Looking at successful solutions that have already been adopted from new companies. How did they get in? What budgets were they going after? How did they get past that filter? Because there are so many people knocking on the doors of long-term care and seniors living and home health care. How did they get past that filter? I think, as innovators, as entrepreneurs, we tend to focus on the problem, and with the problem, the size of the addressable market, and we don't look enough at path to market. How do these things get sold? How do they get adopted? How do they get rolled out? And what needs to be true about my product to help get through some of those gatekeepers in order to actually reach the market that I need. The other thing that I would just kind of caution people about as they're in that B2B space is, there's a risk on one side of overbuilding, of building the perfect all singing, all dancing solution, and then engaging with institutional buyers who say, yeah, I'm really, I like what you're doing here, but I only want this 1/4 part of it. So can you, I don't care about all the rest of that. And so there's that challenge on one hand. And then on the other side is the risk of having to do massive amounts of custom development. People are saying, this is great. Can you integrate it into this other system I already have? Or can you integrate it into, this other process that we already use, where you end up becoming kind of half product development, half custom development. And that both becomes really hard for investors to engage with because they start to worry about scaling, and also becomes a huge drain on your resources because you're constantly trying to tie into other people's systems, and it's just kind of sucking the life out of you over time.
Yeah, that's great. And I know we've seen that in the startups we worked with, for sure. It can be a challenge when that big potential customer is asking you for all of these different changes, and you obviously feel the pressure to do that to get them to buy your product eventually.
And listen, it's not like it's not necessarily the right thing to do to say, no, we will not. We will stick by our guns. We know this thing is right. But it may be that you've misidentified the problem. The thing that you thought was a perfectly packaged, standalone, easy to address solution actually is something that sits in the middle of a thicket of other systems and can't be easily disentangled. But that's, the earlier that you can figure that out, the earlier you can decide whether this is still a space that you want to go after.
That's true. Okay. Okay, we have a few questions from the audience here, so I'll try to go through them in order. The first is from Mary. It's asking, what advice or best practices could you share with companies that are looking to enter international markets? Is this a stages process? So for example, do you need to undertake a larger amount of customer testing, or is it something else?
When looking at international expansion, that question of path to market and user acquisition becomes even more important. So you may have a solution that that could address a problem that exists in multiple markets, but is it the same path to market in each country? So some places have very different regulatory schemes. Some places have very different institutional delivery models where either care is delivered or patients are accessed. And so getting early access to domain experts who can give you a sense of how that market is mapped is really important to figure out whether that's something that's going to be easy to do or hard to do. The one thing I will say is that when Canadians start talking about international expansion, what they often mean is how quickly can we get to the US? And that's certainly a totally viable strategy. But then what I often see is Canadian companies then spending all of their time trying to figure out how to navigate the US market, which especially in the kinds of the kinds of topics that we're talking about today around healthcare and care delivery is maybe the most complicated and baroque market for care in the world. So it's so it may be worth looking at other Commonwealth territories, other places that have similar or analogous healthcare regimes or regulatory frameworks, because while the market may not be as big, you may have a much easier time taking your Canadian-built solution and taking it to Australia or the UK or somewhere like that. So that's just something to think about. The other thing I will say is that often international expansion really depends on that first hire or two you make in that market. And what I've said before to startups who are looking at international expansion is that hiring, your first international employee is kind of like getting a tattoo on your face. Like, it basically defines you in that territory forever and is really hard to undo. So you have to pick really carefully. You have to figure out how you're going to know whether that person actually knows your stuff, because they become both your face in that market and kind of develop that market's perception of what your product or what your company is. They in effect become your company in that territory, and it's really hard to undo if you pick the wrong one, and it's hard to even know if you've picked the wrong one for a while. But it can be done. We certainly did it. We're very glad we did. The last thing that I would say around international expansion is make it as lightweight as you possibly can. Don't build offices, don't sign leases, don't build big teams. Do as much as you can from home base, and then keep your international footprint super, super lightweight, with just as much as you need to deliver those services in that territory, until you're feeling really confident about having both kind of revenue starting to show up, customers who are interested, and then add on a very judicious basis.
Great, yeah, a lot of good advice there, and definitely when you mentioned the first hire, that's I guess that's a huge decision to make that. Well, I personally didn't always think about. Makes a lot of sense. And for those in the audience, just to kind of link things together, you'll get a lot of other great advice on this from at the next session when we have people from the UK talking about the healthcare and healthy aging market there, including the deputy head of life sciences for UK's Department of International Trade. So you can look forward to that. With that, I'll go to some other audience questions for you, Michael. One here links to a personal story, and it's coming from Lee, who's mentioning that one of the recommendations that we received when my father was diagnosed with Lewy body dementia was to get him to talk about the books he was reading. And the question is, does your business model include offering shared licenses for book clubs? And if so, do you need a Kobo device, or can your books be read on Android tablet or iPad?
So to the second part of the question first, you don't need a Kobo device. We have amazing apps on iOS and Android for both phones and tablets. We also have audiobooks, which have also been found to be very helpful for people in care settings, as well as ebooks. So you can do shared listening as well as shared reading. We don't have shared licenses for book clubs just because the publishers don't let us. They really like us to sell them one at a time. But you can have up to 5 members of the family share the same account. So you can be buying a book that, say, both you and a partner, you and a parent are reading at the same time, and we know a lot of that happens. So it's kind of, a couple of family members on the same account is something that happens all the time, and that's a great way to both share a book that you're reading, have a book that you can discuss together, and it's something that we've seen also be really great for intergenerational engagement with older adults. So, a lot of grandchildren, great-grandchildren, go to visit their grandmother or great-grandfather in long-term care, and they don't know what to talk about. Having a book that they're both reading, or a book that they've both read, or reading a book to an older adult who can no longer read, is one of those great ways to build relationship and build bridge.
Okay, that's great. And maybe before I go to the next audience question, to follow up on that, I'm not sure if you're able to speak to it or not, but I know at times you may have had specific initiatives either for older readers or including in senior living or long-term care. I wonder if that's anything you could speak to.
Yeah, we do. We have a great program that we are running right now that we're just starting to look at scaling out. It began with a reach out to Family Councils Ontario, because we sort of do a number of kind of charitable programs across the life course. We work with First Book Canada around books for young children and for teenagers as well. And we were looking for something for older adults, kind of at the other end of the life course, because we knew that access to reading and access to books is both one of the best things that can happen to people as they're in long-term care, as they're in retirement care, but at the same time is one of the things that people often have to give up as you downsize, as you leave home. Usually one of the things that you're getting rid of are books. And then as age tends to take a toll on eyesight, people often find themselves having to give up reading due to macular degeneration or other age-related impacts on vision. So we wanted to start engaging more with older adults and ebooks, because you can make fonts big, you can get audiobooks in front of people. And so when we went to find so who's the charitable group that does literacy and book accessibility for older adults? And while there were probably like 1,000 for young people, there were 0 for older adults. So we went to Family Councils Ontario, who run the family councils that are in long-term care and retirement homes across Ontario, and said, can you help us? And they said, we'd love to, except we don't really know anything about technology. They hooked us up with an organization called Tech Coaches. So they're now bringing e-readers into long-term care and teaching people how to use them. We've had some really great results from that we're starting to try and scale out across Canada, and at the same time teaching people how to access audiobooks through smartphones and tablets so that they can listen to books if they don't want to or can't read them. And so that's been going really well. But one of the things that's certainly become clear is like the need for hands-on help, the need for people to help walk some older adults through things like setup processes and even things like Wi-Fi connectivity have shown us just how many barriers to adoption still exist for older adults, and that's been really helpful for us too.
Great, yeah, and it's awesome to hear about that kind of work going on, and I know we'll probably be following that closely at AgeWell, seeing where it goes. So I'll go back to an audience question now, and it's a B2B related question. And the question is, for startups interacting with businesses that have an impact on the aging population in terms of health, so for example, food vendors or restaurants, how do you approach them with an idea that may cause them to reduce business, but promote the health of the user?
That's
that's a tough question.
Yeah, it's a tough question. It's a little outside of my wheelhouse. But what so when we're trying to get people to do something new, and this is an idea that I've stolen from Dr. Victoria Medvec, who's a specialist in negotiation. when you're trying to get people to do something, the approach that you take depends on whether you're trying to get people to move to doing something new or double down on a thing that they already do. If you're trying to get people to move to something new, they tend to over focus on risk and under focus on benefit. So in the case that you're describing, where what may result is a depression of revenue, or you might be doing something that's good for the user, but is going to result in a loss of sales or revenue for the vendor. Focus on the risks. Like, what are the risks that they avoid as the result of taking up this new solution? Is it liability? Is it increased staffing costs? Is it regulatory exposure? What's the risk that you're helping to mitigate by getting them to take on this newer, better behavior that you want? It's really hard to get people to focus on the benefits of something that they've never tried before, but as a species, we tend to overemphasize risks in things that we don't know or aren't comfortable with. So that's something that we can use to help nudge people towards the thing that we're trying to get them to do. And so that may be helpful in the situation that you're describing.
Yeah, no, I thought that was great. So I know we're kind of coming up on the hour, so I'm going to give you an option of answering two questions. One is a general one, if you have any other advice or kind of parting words for entrepreneurs, but if you want something specific, you can also answer any insights you have on building a team. As I know some of those in attendance are at the earlier stages. If you have any advice for building a team, I mean, in general, or if you feel it's necessary specifically for a market like older adults.
Yeah, I've been in and have seen companies that have tackled domain-specific problems without having any domain experts in the team and do well. And I've seen ones that have completely blown up. I've also seen companies and organizations that were filled with domain experts and still couldn't crack a particular market. So it's not like there's any one particular solution to that question of how do you get into a market that you don't necessarily have direct access to. But one thing I can say is that access to feedback or users is incredibly important, even if they aren't on the team, with the understanding and the caveat that they can usually tell you the problems they're facing, but they're not necessarily great at suggesting solutions. And that's something that I would recommend, even for the people that you might have inside your company who are domain experts, is use them as a sounding board to find out what are the barriers to adoption, what are the things that are difficult, or what's the problem that's being faced. But the whole reason that you're there is to try to come up with a new solution, a different solution that domain hasn't come up with so far. So having people that you can use as a sounding board is incredibly important. Also realizing that each time you go back to them, it's harder to get that first time feedback from them. You're effectively training your feedback people to your solution over time. Whether they know it or not, they're getting more comfortable with the ideas that you're putting in front of them over and over again. So you just have to be aware of that. But the one thing that I would say is that the needs inside a startup are much more about striking this balance between empathy and innovation. That innovation helps you solve the problem, build the new thing, look at the problem space in a new way. But empathy helps build solutions that get adopted and meet the needs of people where they are, rather than where you wish they were. And and empathetic engineers are sometimes in short supply, and so it's always a good idea. It's like, well, of course they should use it this way. This is so much more. This makes so much more sense in the way that they were doing it before. But the same is true of the reverse is true of domain experts. There are a lot of people who know the space really well but aren't especially innovative about it. So it's putting those two together that is kind of the magic, and looking across your organization as a leader and saying, do I have all of those skills in place? Do I have not just people who are innovators, who are solution focused, who are technically skilled? Do I have people who can internalize the needs of the customer or the user or the patient and think about the solution through their eyes? Because that's what's going to determine whether the thing actually gets adopted, no matter how good the solution is. And especially in the area of working with older adults, that's incredibly important because, in the language of diversity and inclusion, it's a population that gets othered really easily. It's the number of startups who have decided all I need to do is put a tracker on grandma, so that if she wanders when she has dementia, that's a massive market and I can do really well with that. Well, you know what? First of all, she probably has a name. Second of all, she probably doesn't want to have a tracker attached to her. And in her lucid moments with good decision-making capability, she's going to take it off. So, so just thinking about it from the point of view of the person who is, who's going to be on the receiving end of the solution that you're trying to create. Realizing that that's a real live person with wants and needs and rights, and then looking at what's going to make their life better, not just for their caregiver, not just for the institution that's taking care of them, but for the recipient themselves, is going to take you a long way towards coming up with something great.
Great, awesome. Well, thanks. You managed to really kind of answer both in a sense. So that's fantastic. So first of all, thank you very much, Michael, for giving of your time to answer all these questions. I think there's a lot there to think about, and I'm glad that this is recorded so that we will be able to share it beyond and let other people benefit from those insights. I know there are probably other questions we could have had you answer, but this is amazing, and I think it's really helpful. So thank you for that.
Listen, I can this kind of stuff I can talk about all day. If you've got any other specific questions, feel free to reach out to me at mt@kobo.com or hit me up on Twitter at mtamblyn. And yeah, good luck with all of the work that you're doing, and hope it all goes well.
Thank you very much, Michael. So with that, to the audience, we're gonna go to the next session now with our friends from the UK, and I know we may have some quick remarks to transition from AgeWell's CEO and the scientific director, Alex Michaelides. Hi, Alex.
Great. Thanks, Mike, and thank you, Michael, as well. Good to see that our beards are both coming in with the gray streaks on both sides, so it's not just me. But this is really, really exciting, logging on here. And unfortunately, I can just stay for a little bit, but seeing that there's 42 people involved, and this program that Michael's been putting together with our friends in the UK is just been outstanding. And I think this is really testament to the importance of international partnerships and collaborations across everything we do, including startups and entrepreneurship. And during these unusual times we're going through, again, I think we're also showing that the challenges that we always thought may have existed in doing these things with partners like Nigel and others in the UK perhaps not are as challenging as we thought. With the tools and the platforms that we have, and the will of both organizations to go ahead and do something like this. This is something that I think is going to continue to grow, and I think something that will become a mainstay of at least AgeWell's efforts moving forward, even beyond the pandemic. And more importantly, something that we hope to grow together. So again, I just wanted to say a few words and stop in. And obviously, thank you, Michael, for his comments and his talk that he just gave now and his offer to continue to support, but also thank you to everyone that's on the call. So I'm going to hang out for a little bit and listen to some of the presentations, and then I'll drop off when I need to. But this is really, really exciting. So thanks, everyone.
Great. Thanks, Alex, and thanks again to Michael. So without further ado, we'll get right into our next session, which I think will be of great assistance to a lot of the startups that, whether right now or in the future, are going to be looking at entering a different market, and actually even those that aren't, that are going to get some insights on healthcare and health technology, as well as healthy aging. So with that, I'm going to introduce the first speaker of that. And really, just to set the context, we're working on developing this kind of partnership with the HSN network to make sure that we can benefit startups and entrepreneurs in Canada looking to enter a different market, and at the same time make some great connections with the UK and entrepreneurs from there. So we're going to hopefully be doing more of that in the future. You will get a very brief, less than 2-minute survey after this event to provide your input on what you'd like to hear more about. And we hope that from everything you get, you'll get some ideas and give us a sense of what you want to see going forward. So with that, I'd first like to introduce Dr. Nigel Harris to, or actually, I apologize, I don't think, Nigel, you're starting. I think we're going to go straight to you, Neville, and you're going to give us an overview of some of the work that's being done by the HSN. So I will not waste up any more time and hand it over to you.
Thanks for that, Michael, and I hope I won't be too disappointing not to be Nigel just yet, but we'll get there eventually. So great to be here. Great to be interacting across the Atlantic as well. You're right, the technology enables us to do this, and we need to take advantage of it. I'm going to talk for about 10 minutes today about the Academic Health Science Network, the HSN, as we call it, and what we're about and what we're doing. I'm not going to specifically talk about innovation in aging, but I'm going to talk to you about some of the guiding principles and our values really as an organization, and what we want to do to really improve the outcomes for citizens in the UK, not just patients, but our citizenry as a whole. The HSN was formed in 2013. We're funded in a really interesting way. We receive a big chunk of our funding from the NHS, obviously, because we're a healthcare organisation. But we also receive quite a chunk of funding from the Office of Life Sciences, which is a part of BES, which is Business, Energy and Industrial Strategy. And that essentially means we have got two taskmasters or commissioners who have, on the face of it, you might think conflicting views, but and needs and desires, one around health and health improvement and the other around economic growth. But actually, by working with industry, we really see those two things as two sides of the same coin. If by supporting industry to drive innovation into practice in the NHS, we can improve outcomes for patients, save the health system some money, and build really good jobs and really good businesses in the UK. And we're really interested in innovation that meets those values of ours as well. And our values are really about, helping and supporting, patients and citizens in the UK live better lives. So what is the AHSN? Well, we're a connected network of networks, I guess, is the best description of us. So the AHSN network consists of 15 individual AHSNs covering the whole of England. You'll see Scotland and Wales and Northern Ireland lopped off this map. But don't let that put you off. We do have good contacts and reach into the devolved nations as we described them in the UK. Nigel in particular is down there in Bristol. He's got Wales next door. He's got great reach in there. And indeed, we were in Northern Ireland just before the pandemic, talking about what we do in that market and encouraging their innovators in those markets to come to the UK and helping them map out why they might want to do that. So we're a connected network. We've got loads of expertise in the network. We're funded to the tune of about 60 million pounds a year spread over the 15 networks. And probably in total, there's maybe 700 or 800 people working in the HSN across the whole of England in the 15 different organisations. I'm based in Yorkshire and Humber, which is sort of on the top right of your map there. But I don't want to talk too much about individual HSNs. But one of the things as a part of our core values is at the heart of it, we are interested in serving the needs of our communities in those regions. That's why we've been broken up into that regions, so that we can get really in deep to the challenges that the health service has in each of those regions. And in my region in particular, which will be different from Nigel's region and which will be different from Susie's region, these are some of the challenges I have. So we've got about 6 million people living in Yorkshire and Humber. That's more people than live in the whole of Scotland, and I think it's actually more people than live in Belgium. So we've got a massive population. We've got quite a big geography. We've got 22 hospitals, 6 of them are teaching trusts. We've got 15 local authorities. We've got mental health trusts. We've got commissioning groups who they're the payers in our system. We've got 770 primary care practices, GP practices, and we've got something like 1,400 care homes as well. And that's just Yorkshire and Humber. So what's important in my region are the things on this slide. So we've got terrible smoking rates in our region. And so that's something we've got a particular interest in. We've got less life expectancy in my region than other parts of the UK. So we're interested in understanding the determinants of some of those health deficiencies in our region as well. And we're particularly interested in innovations that really tackle some of these meaty challenges. And that's because we're really connected into the region in Yorkshire and Humber about those needs, and some of those needs overlap across the entire network. And so there are some big ticket items that we can get into and talk about: diabetes, long-term conditions, frailty, multi-morbid patients and the elderly that are common across the network. But there are also individual flavors of each of the regional AHSNs that will really help you with your innovation and really map it to a clinical need. And we work across the entire system. We work with the public sector. We are, as I say, commissioned by NHS and the Office of Life Sciences, but we work with, NHS Improvement, NHS Digital, NHS X. That's the latest one in the UK. I know this is a bit of an alphabet soup for you. And if you're coming into this market, that is a challenge, just learning all the acronyms. And I certainly, I'm usually challenged twice a day on what does a particular acronym means. But again, we're here to help map out that journey for you and deconstruct some of the challenges with the acronyms and everything that's behind them as well. We work strongly with the private sector, and not just health tech. We have relationships with the likes of Amazon, Google, and places like that as well for some of the projects that we're delivering, as well as your traditional health tech sector, the big players, as well as the small SMEs and entrepreneurs. We work with all of the funders in our system as well, and we're really keen to work with innovators to access that funding, whether that's through the National Institute of Health Research or it's Health Data Research UK or any of the other plethora of funders that exist over here as well. We will help navigate your journey to those funders if that's something that you need and is beneficial to you. And we work with all of the third sector charities as well. And that's really helpful for us because patient public involvement in what we're trying to do is a really important theme that sits with our values very strongly about how we work with industry and the system as we bridge the gap between those different sectors. And a lot of our I would initially, on the back of this call, and I think Nigel will say the same, we'll direct you to the Innovation Exchange website, which is part of the overall AHSN website that is specifically designed to help innovators enter the market in the UK. And the sort of challenges, if you come into that route, you'll find your way to an AHSN, and we will really work with you about really defining and articulating the needs of the system in reference to what your innovation is, and making sure you really understand what the need in our system is and where your innovation may or may not play a role as well. Because you may fit neatly into a box in Canada. It's almost certainly that you will fit into a box in the UK, but you might rattle around a little bit until you find that right positioning. And we're here to help you with that as well. We do an awful lot of signposting and support to innovators on their journey. It's about connecting, it's about signposting, it's about getting you to the right people in as easy a journey as possible with as few steps as possible. The healthcare market isn't any easier in the UK than it is in your own market. It's always a challenge if you're an innovator to bring a product to market, and we're here to help you with that. One of the things I think we've specialized in the AHSN network over the last 2 or 3 years is this idea of real world validation. And we actually fund activity in this space in some of the networks as well. And what we're really interested in is bringing the gap between the promise or the sales pitch of an innovation and the reality of what happens when it's deployed into practice in the system at large. And it's really about understanding that gap and how close that reality is to the promise of an innovation. things never really, very rarely, deliver exactly as per what they say on the tin. That's okay, but it's just understanding what that uncertainty is around that. And that's one of the areas as an HSN, we spend a lot of time with innovators trying to work out. Sometimes for some innovators, it's as important to know as how many people will use a thing as to how efficient it is. That affects the price, that affects how you enter the market. And that's the sort of real world validation that we often get involved in. And once we've got all that, we're very helpful, we think, certainly at helping adoption of technologies at scale across the NHS. And that's really the holy grail. You know, all of those hospitals I talked about in the UK, every single one of them set up as its own legal entity. So you may think that the NHS is one system from the outside looking in, but it's not. It's actually very fragmented under that hood. But we as an HSN network have those relationships individually in our regions to help with those individual challenges that you will have as you want to scale up an innovation and spread that out at pace. And, you know, a lot of our work is guided by the NHS long-term plan. Of all the things to maybe pick up and read before entering our market, that's probably the one document. It's quite a meaty and long document, but it's definitely worth having a look at. The priorities in the long-term plan, even in a COVID environment, a pandemic environment, are pretty much the same. Investment in primary and community care, health inequalities and tackling health inequalities and really understanding the determinants of health in the different regions in the UK. Improvements to care quality and outcomes, that's a really big driver. And workforce and adding pressure to the workforce is something we don't want to do. So that's a factor that will be looked at when you bring an innovation into this market. How does it fit to the workforce? And obviously digital is a massive thing in the UK at the moment. I've just come off a call with a national pathology imaging collaborative that's going to be producing 3 petabytes of imaging data a year in 3 years' time. And so there's a massive interest and investment in digital infrastructure in the UK. And being aware, if you're bringing a digital innovation into the UK, you're going to have to plug that into the system here when it gets here. Again, the HSN can help you with that and point you in the right direction where that guidance exists about how you have to fit to get your data as you produce it into the electronic patient records as they evolve as well. And obviously, you know, we're looking for that sweet spot for innovations that save money and improve patient outcomes. And I think, you know, that's a space everybody claims to be in, but it's also a space that needs tested in those real world evaluations. But if you can demonstrate that, we can help you with your spread and adoption plans. I think I'm not going to go into too much details about these actual innovations, but you can see, I think the influence the HSN network can have when at a national level, we get hold of an innovation and are collectively asked to drive its adoption into practice in the UK. TCAM is about when patients leave secondary care, digitally sending a copy of their drug prescription to a community pharmacy, who then invite the patient in to do a medicines review. And it saves an awful lot of patients who leave the hospital slightly confused with their medicines, taking their medicines incorrectly and rocking up an A&E with either an overdose or some other medication problem that they've had. And proven innovation, lots of evidence around it. HSN's got hold of that in March last year and have driven the adoption of that in trusts across the UK at pace and at scale. And we can demonstrate that. We've got the numbers, they're on the slides, and obviously we'll share them afterwards. But I think this is more, it's just evidence that we know what we're doing in this space if we've got the evidence in place to help the companies talk to the NHS about why they should invest in some of these technologies. This is Precept. This is a really simple innovation. This is about giving preterm moms a bolus of magnesium sulfate prior to them having a preterm baby. So within 24 hours of them having a premature baby. If we do that, we can reduce the numbers of those babies who are born with cerebral palsy from about 1 in 64 to about 1 in 30, roughly. We've driven uptake of that program across the UK at pace and at scale. The lifetime savings of, as you can imagine from this program are absolutely enormous. It's such a simple innovation. And so we're as interested in the simple stuff as we are in the hard stuff. And this is a really good example of a program of work that the HSNs have got in behind and really significantly changed the outcome in England. And we know we've done this really well as an HSN, because when we look at Scotland, who doesn't have an HSN, they haven't seen anywhere near the same uptake that we have seen driven in England because of the work we've done collectively as a network. And there's a whole list of other things here, from EndoCuff, which helps the visualization of adenomas during colonoscopy. I think it costs £5 each, that EndoCuff device. And again, we've really driven that adoption of that in a short period of time, up to almost 3/4 of the eligible sites in the UK. Securacath, another simple catheter device, but also something like HeartFlow, a really complex digital innovation that takes imaging from a CT scan of a heart and really decides whether you need an angiogram or not. That's a company based in the US, so who've come into our market. They've built up a really solid evidence base, and it's not a cheap innovation to use, but it's cost saving in the long run. And we've really helped drive that into use in the UK over the last 2 years, from a very, very low uptake to really quite a high uptake. You need quite a high grade scanner to take this on in your hospital. And I think we've got something like 80% of all the eligible sites are now using that piece of kit, and the HSN networks help drive that into practice. I talked earlier a little bit about digital being such a big driver. This is a slide taken from my own region and some of the work we've done on creating a digital electronic patient record for 5.8 million patients. That's had significant capital investment from government. And what do we want to do? Well, we just want people to see the right information at the right time to improve their care. And that means things like when you get, if you're in an ambulance and you're being transferred to hospital, an electronic handover of data as you come into the ED. It's about making sure clinicians have the right data from your primary care record when they're treating you in secondary care. And, in many ways, that sounds like, what everybody's been trying to do with electronic patient records for many years, but actually connecting that up over 20 hospitals, over 6 million, around 6 million patients, and giving patients access to that record as well is a real challenge, but it's almost cracked in the UK as well. And I just put this in just to re-emphasize the need to be digitally ready for when you enter our system as well. And, in our patch, we've now over 100,000 people interacting with their entire healthcare record through this system. We've done 40,000 transfers of care out of the back of an ambulance into EDs in the region. And, end of life planning records are now onto the Yorkshire and Humber Care record as well. So that when an ambulance turns up at a care home, if a patient doesn't want to be transferred to hospital and their end of life decision is about staying where they are or going to their home, we can do that and treat those patients really well at an end of life stage as well. So there's all sorts of benefits from engaging in digital. And the work I'm talking about here in Yorkshire and Humber is being replicated across the UK. So I would say if you're coming to the UK as a market, be digitally ready, connect to an AHSN. You've got 3 or 4 of us on the call here today. We are very keen to find the best innovation to bring to the UK. And you'll actually find us quite competitive if we find good innovation. We'll all want it in our patch first, but we will share it around. We're not interested in hogging it and holding it. We're interested in being the first landing site and then spreading that around the network. So I don't know whether I've beat my time or not, but I think that's my last slide. I would encourage you all to connect with us if you're interested in landing in the market. And I'll hand over now to Nigel, I think, who's going to take on the next bit of activity. If I can come out of screen share mode. Let me see if I can do that. There, success.
Great. Thanks very much, Nev. That was super and nicely to time as well. So that's great. Thank you.
Very unusual for me, Nigel.
Great. Okay. So I'm just going to share my screen and see if the technology works there. So hopefully you've got my slide there for the AHSN network. Great. Thank you very much, Nev. Great. All right. Well, I've got 10 minutes to give you a market snapshot and understanding routes to market. I'm going to focus very much on products for an aging population. So that's going to be where I'm coming from. I couldn't resist sharing just 2 slides around some of the background. If we think about how products are received, so sometimes we do actually want them to signal something about us. But what's pretty common around products for an aging population is that generally we don't want them to signal that we're aging, and certainly in the UK, and I don't know about Canada, there are quite negative perceptions around aging, and this really does have a significant impact on how products are received. And as you can see from the image on the right, it does mean you need to think really quite carefully about the marketing material that you're going to be using. Of course, negative perceptions are one thing. There are other societal influences, for example, around family. And as you see from the link at the bottom there, there are a range of sort of technology acceptance frameworks around that explore these sorts of aspects. One of the key ones is around who's buying and who's using the technology. So in the case of a health professional purchasing the equipment, usually from a call-off catalogue, the user actually gets no choice about what's being provided. It's usually the cheapest product in a category. And of course, this leads to many products being discarded and not used in the end. At the moment, in terms of a mainstream market, I would say that very often it's family members who are concerned about their parents and who are buying products for them. So again, the end user may actually have relatively limited choice about what their son or daughter is going to thrust upon them. And what I want to flag up is that as we have effectively what we call a baby boomer generation, so a lot of people born in the 50s and 60s that are aging, they're much more engaged about their image and about their buying decisions. So I think we will see going forward an increased influence of those in that group, that senior group, making decisions and buying products themselves. Now, as we think about the market segments, I've identified 7 here, but just thinking particularly about products for an aging population, we're going to discount hospital or acute care, and we're going to discount family doctors or NHS primary care who don't really buy significant amounts of equipment. So I'm going to go through each of these in turn. So when you get discharged from hospital, you will get discharged into NHS community care. And very typically you'll have what's called either early supported discharge, getting you out of hospital as soon as possible, reablement or rehabilitation. And typically these programs last for around 16 weeks or so till the person's back up and running again. Or if you've got a long-term condition, something like dementia or incontinence, or it's a condition that needs end-of-life care, then you may receive support longer than that. We have what we call community equipment services, and they're contracted to provide equipment for those patients at home. They're dominated by 3 big players in the UK, Mediquip, NRS and Millbrook. They all have extensive equipment catalogues and significant buying power. So if you're thinking about entering the UK market with equipment, then you should be checking out the community equipment services. Local authorities have a duty to provide social care and to support local health care. This is an example of the Wiltshire Health and Care Wellbeing Strategy. This is where I live in Wiltshire. I think we agreed at a seminar last week when we had a reciprocal audience that Wiltshire was one of the most beautiful counties in the UK. It's got an ageing population, so it has got significant challenges. And you can see just from this box here that the healthy life expectancy is around 65 years, but life expectancy is around 80, 85 years. So you can see that potentially there's a gap of around 15 or more years where people may live not particularly in good health. But the challenge is that although local authorities are buying equipment and providing equipment, this really is focused on only those with the very highest needs. So you'll see from the links that I provided at the bottom that there is an assessment there, and really if you've got any independent financial means, you will not be eligible to have support provided for by the local authority. So moving on now to thinking about charities. So Age UK, I don't know if you've got something similar in Canada. Age UK is one of the biggest national charities, and it also has local affiliated arms that provide services. The national charity does have a commercial arm that sells services, and these are very typically products like stair lifts, personal alarms or funeral plans. So it really not really a particularly great message, necessary, but not really maybe what some people are ready for. There are some also very good carers groups. So this is Carers UK, and they have some great resources for carers. But at the moment, I think this is an opportunity area at the moment that they're not particularly considering around brokering or supporting equipment or products. So moving on to some of the, this is a sort of a hybrid between a charity and a provider. This is the Disabled Living Foundation. Now they have a professional service where they have a database of a whole range of assistive technology products and enabling products available in the UK. And this is a professional resource, so all the occupational therapists in the UK will have some sort of subscription to the DLF, so they'll be able to search the DLF database for products for their clients. The DLF also has this Ask Sarah tool, which allows carers to log on and to go through effectively a self-assessment in order to be able to select a piece of equipment, for example, if they've got rheumatoid arthritis to help with steps or getting out to the bath or whatever. So there is this consumer-facing arm, which does provide recommendations rather than a full retail service. So just moving on now to commercial providers. There are a range of independent high street retail shops, mostly focusing around mobility and toileting products. Very often the service is quite good, but they are obviously selling on the basis of commission. The UK Consumer Association, which is called Which, has got a really nice survey of independent living retailers, and you can see that there, and you'll find the links there, and that's worth checking out if you're thinking that that might be your route to market. Now, there have been attempts at online specialist retail sites, and I think Spring Chicken is probably one of the best. It does focus on some of the more attractive products, and is a useful route to market, although I'm not sure what its sales volume or market share is, but it's been established for a number of years now and has a quite good presence, so that's worth checking out. Now, just coming to the final segment, of course, which is the mainstream market, which inevitably is dominated by Amazon. I've got mixed views about Amazon, but it does make products accessible and visible. And it means that people can search through a massive range of products, often put on by sponsored or by third parties, and they can make a selection and buy items. Very often, again, as I mentioned, it's the children of those with elder parents who are going onto Amazon and buying these sorts of products. So it's there, it is a great resource, but people are often very uncertain about what the best product is to buy. And then I couldn't move off retail without just referring to sort of the smart tech and smart home sort of revolution. Our electrical shops have all now got a selection around smart homes. And of course, as we're thinking around supporting people, helping people live independently in later years and concerns about falls and long-term conditions, then there's no doubt that some of this technology it does have a place and is seen as a much more acceptable solution than some of the sort of traditional pendant alarms that you'll all be familiar with. So just to finish off now in the last minute or so, I wanted to flag up some useful resources. So the Digital Health and Care Alliance looks across the board, obviously, at technologies to support digital health and care. It's supported by one of the AHSNs in the south of England. They have some really good webinars and resources. The full recording's available. I've put one here in the link, which you'll be able to pick up later. And this was looking about assistive technology for carers. So there were speakers from Carers UK, and there was also somebody from Canary who make alarms who tried to do a retail direct-to-consumer and ended up selling B2B. So there's some really nice sort of lessons there and really some good sort of useful background there, so on the DACA website. Innovate UK supports companies with R&D and helping them to get their products to market. They have a range of funding schemes, some of which can include international participation. They're running an industrial strategy challenge fund around healthy aging. There are a number of programs of work underway. These were underpinned by work carried out for the Centre for Ageing Better that you can see here. And there's a really good link to a strategy review around looking at healthy ageing, innovation and investment in the UK. So I think if you're thinking of coming to the UK with your product, that really is a must-have read. Finally, in the West and Southwest, there are some local networks. This is our Assisted Living Action Network with a quarterly evening meeting, which would work quite well for you guys in Canada. A range of topics around assisted living. The next one is upon motion sensing and motion capture, but you'll see some really nice slide sets from previous meetings around assistive technology, around supported living environments and disabled living facilities grants. So some nice presentations and material that's accessible there. And then finally, just to reinforce Nev's message, the AHSN network is here for you, so you can see the link for the innovation exchange, for the contact form. We do have something like a pro forma, what you call a company registration form, so don't be at all shocked or surprised if we ask if you wouldn't mind just having a go at filling the form in, and that just gives all the essential items of information about your innovation and product and where you are, and just helps us have a more meaningful and high level engagement for you. So I hope that's been helpful. We've got a Q&A later on, so we're going to move on to our next speakers now, and I'm going to hand over to Nev again just to introduce that. Thank you.
Thanks, Nigel. Really good to see that. It's always good to hear a talk where you learn something, so it's always good. So thanks for that as well. It's really informative for us in Yorkshire and Humber. Thank you. So we've got Heather Cook on the line, I think, and Heather works for a company called Brain in Hand. She doesn't actually handle brains. But I think, Heather, maybe you could give us your 2-minute elevator pitch, and then I've got a few questions that I want to ask you.
Yeah.
Hopefully set the scene a little bit. But if anybody else wants to ask a question, stick it in the Q&A and we'll get it to Heather.
Okay, good evening or afternoon, everybody. Lovely to join you today. Welcome from sunny Manchester. So I live in the north of England, just to the left of where Nev hangs out. So I represent the company called Brain in Hand. So let me tell you a little bit about what it is that we do. So Brain in Hand is an innovative support system that we've designed to deliver significant improvements in the quality of life for our users and to ease the burden on statutory services, and importantly here, to drive down costs. So what is Brain in Hand? So our system combines, on the one hand, human support with ubiquitous technology in the form of a smartphone and access to a web service. And together, we're able to prevent problems from our users escalating. We help people to live more independently and empower users to feel more confident as they work to achieve their goals. There are 3 elements to our system. We provide human one-to-one support planning sessions. We pivoted at the beginning of the coronavirus pandemic, and now we provide all our services virtually. These sessions are held privately with our users, and we identify with the users the goals that they want to work towards. We work with the users to identify their strengths and, really importantly, identify the problems that are getting in the way of them achieving their goals. And together we'll work through the development of some solutions and strategies to help the user attain what they want to achieve out of life. Secondly, we provide web-based and mobile phone access to these best coping strategies, so the user carries them around with them at all times. And the third element of our system is a mood monitor and a traffic light indication system that can call on extra help when it's needed. This is non-medical help. So if a user needs a little bit of support at 3 o'clock in the morning that potentially, if left unchecked, could lead to a crisis, the user can access round-the-clock support from a non-medical helper to help them get their day back on track. All of this combined reduces the burden on statutory services to provide support, and therefore ultimately helps to reduce costs. Okay, so that's what Brain in Hand is in a nutshell.
Thanks. That's a great elevator pitch, Heather. So I think I've got a few set questions that I'm going to ask you that'll hopefully help other people on the call understand a little bit about the NHS market. So I think one of the first ones was about who buys your product and obviously who benefits from your product, and how do those two things potentially cause a challenge and an opportunity for SME in the market in the UK?
Yeah, that's a great question. So been around for about 10 years now, and it hasn't always been plain sailing. I've been with the business for about 7 years. Joining really right at the beginning of our sort of commercial journey. We had no sales, we had no commercial product. We were really in the very first stages of ideation. And today we've supported over 10,000 people with our system. So it's really that sort of interim period that I'll just talk about. And I think I can't answer that question without looking at the addressable need that Brain in Hand meets. And I think you picked this up, Nev, really well in your presentation. So let me talk about the addressable need for us there. We're not an aging product yet, although we do believe that there is potential for Brain in Hand to be used in this way. But let's look at mental health, and this will help answer who buys Brain in Hand. So in the UK, I'm sure it's the same in Canada as well, mental health problems affect 1 in 4 of us and cost the UK economy over £100 billion annually. That's roughly equivalent to the entire cost of delivering the NHS. Breaking that down a little bit further, autism, which is a very popular area of the need that Brain in Hand meets, affects around 700,000 people in the UK, and a large percentage of these people don't receive services that they express a need for. And autism specifically costs more in the UK than heart disease, cancer and stroke combined. That's about £32 billion a year in terms of diagnosis, lost income and care support. So what we did at the very early stages of our evolution, we really worked out who Brain in Hand could help, and it helped us to identify how to engage with the support providers that would adopt Brain in Hand. So today, Brain in Hand is proven in local authorities to drive down costs and improve outcomes. So today, over 30% of English local authorities buy Brain in Hand in 1 or more service areas. Central government funds Brain in Hand so that any university student with a mental health condition or an autism diagnosis can have Brain in Hand paid for. And we're just starting off now with our NHS expansion work, and I'm delighted to be able to share that we've been awarded quite a significant grant of £800,000 by NHS England to roll out and spread the adoption of Brain in Hand across 5 new NHS sites. But there are still many answers to questions that we have not yet met. And over the next 12 months, we'll be working with the HSN network to try to quantify more specifically not only how Brain in Hand helps from a clinical perspective, but also what economic savings can be made by the introduction of our system.
Thanks, Heather. That was really good. I think that bit about really understanding the need in the system in the market that you're in is really, really important. And even within the UK market, there are different potential customers with similar but not identical needs, and really being able to talk to each of them individually is challenging for a small SME, but you kind of have to do it, I guess, in a way to get that contract signed. So it's not easy, but it requires quite a bit of graft and effort. And I think on that point, really, I think I guess we need to ask you how the HSN has helped, or in fact, if it hasn't helped, now is your opportunity to hold us below the waterline. But we've had some positive engagement, I think, with Brain in Hand, and I think, you know, it's not easy for us, it's not easy for you to get those engagements right as well, but maybe talk a little bit about that journey as well to help other people.
Yeah, absolutely. I'm smiling because I often think, would I have started 7 years ago if I'd known then what I know now? And I'd like to think that I would, but 7 years ago, I can only describe it as being unconsciously incompetent. I really didn't know what I didn't know, and I think I was really naive because it was obvious that Brain in Hand helps people. It was really obvious to us that Brain in Hand really does improve the quality of life. So why wouldn't you want to buy Brain in Hand? But that was a very, very naive position, and one that I think the majority of innovators that are new to this game probably go through. So I first came across the HSN network when I was sort of scratching my head, trying to work out how I was going to have a conversation with one of my local mental health trusts in Manchester. And I came across something called Health Innovation Manchester, which is HSN on my patch, and they were running a series of sort of training sessions, seminars called Step into Healthcare, and this series of events promised the opportunity to learn more about procurement in the NHS, how to develop something that you'll all become very familiar with if you're going to start working in the NHS, to produce a compelling value proposition, what features needed to be in that value proposition. We were taught how to pitch to NHS procurement, and really importantly, Nev's just mentioned this, we started to get exposure to the really complicated multi-level selling that is required to get innovation adopted. And by that I mean there's no point just pitching to a procurement expert or pitching to a clinician. You have to look at your economic buyer, your technical buyer, your clinical buyer, and make sure that the way that you're presenting how your system or your solution can address their unmet need resonates with their particular specialty. So that was probably 4 years ago. From that program, we then leapfrogged onto another digital health innovation accelerator program, which again helped to fill a few more of the gaps. And at this point, I'm now starting to think, are we ever going to be able to really describe how Brain in Hand can help? But the HSN network really helped us to really ask us very, very difficult questions that required a hell of a lot of thinking and resource to answer. I then realised that there wasn't just one AHSN in Manchester, there were 15. So I developed relationships with 3 others, and those 4 AHSNs now are providing a huge amount of support to Brain in Hand. And actually, without the support of the AHSNs, we would not have received this grant funding from NHS to help us with part 2 of our journey. I recently just applied for another programme from NHS England called an Innovation Accelerator. And again, without the support of the HSNs that we work closely with, I don't think we would have felt confident to make that application, because it's really difficult picking up the phone, expecting to have a conversation with a buyer. If that buyer's never heard of your product, if you're new into the market, it's almost impossible. So you need the HSNs to really believe in you, to help you have those conversations and help you answer those really tricky questions that perhaps you haven't even thought need answering. So I think that's a very honest appraisal, Nev.
Thank you, Heather, as well. And I think, you know, it is a challenging market, and you need to understand where your product sits in an entire pathway from a clinical and a payment and a benefits aspect. So I think it's really good of you to highlight those multifaceted approaches that we can help with as well. I think I'm going to draw this bit to a close, Heather, because I think we're already running behind. But I'd really like to thank you for taking the time to join us today.
You're very welcome.
Your journey and to talk about the HSN network as well. And we wish you every success, and we hope to see some of that contract money spent in your third
and
number.
I should one thing I didn't mention, which I really should do, is that we have our first international sale now, and that is in Canada. So we're working in Nova Scotia with an amazing company called Distinctability. We've partnered with Distinctability, and we're working with Autism Nova Scotia, and we have about 35-40 Canadian autistic service users now using our products. So it's great that Canada was our first international overseas territory.
Well, it's great to have international companies on these calls as well, Heather. So thank you very, very much for taking the time again.
You're very welcome. You're very welcome.
Well, I think it's over to you now to help us outline some of the really, really helpful support offers that DIT, Department of International Trade, can help with anybody coming into our market. So Will, please take it away.
Great. Thanks very much for the handover, Nev. And yeah, to briefly introduce myself, I'm the Deputy Head of Life Sciences at the Department for International Trade. And to give you a broad overview of the department's remit, is our job is to help businesses export, to drive inward and outward investment, negotiate market access and trade deals, and also to champion free trade. So my role in particular is to support UK exporters in the healthcare and life sciences sector to sell to North America, as well as supporting companies, international companies from North America, so including those in Canada, of course, to bring their technology to and invest in the UK. My team and I work very closely with colleagues overseas to connect the likes of the entrepreneurs in the audience and to support you in establishing a permanent presence in the UK. The offer that we have is very much complementary to those of the AHSNs that have been explained to you earlier, but we have a sort of a UK-wide mandate, and other teams also support other sectors. I'm very fortunate to have a couple of our sector experts on the call as well. So Julie Taylor, who covers healthy aging, and Neil Ebenezer will join me and say a few words to cover those markets. And in fact, I'll hand over to Julie now to give some more detail on the specific healthy aging proposition.
Thank you, Will. And yes, my name is Julie Taylor, and I am the Healthy Aging Specialist based in the Life Sciences and Healthcare team in the Department for International Trade. I'll take a couple of minutes to speak on healthy aging in the UK and then hand over to my colleague Neil. So the UK government's industrial strategy sets out grand challenges to put the UK at the forefront of the industries of the future, ensuring we take advantage of major global changes, improving people's lives and the country's productivity. One of these challenges is the ageing society, where we aim to harness the power of innovation to help meet the needs of our ageing society. Our mission is to ensure that people enjoy at least 5 extra healthy, independent years of life by 2035. And the Department for International Trade is responsible for delivering the trade and investment element of this grand challenge. We know that a child born in the UK today has a 1 in 3 chance of living to 100, and the chance of living to 100 will double over the next 50 years. So this increased longevity is partly due to a paradigm shift from treatment to prevention, and is opening up new opportunities as we live and possibly work for longer. So aging is inevitable, but how we age is not. And healthy aging is more than simply the promotion of good health or the prevention or treatment of ill health. It's about creating supportive products, services, and environments that maintain people's functional ability so that they can continue to be active and productive members of society. So there are sizable economic opportunities. For example, by 2025, the global connected health market will be worth $200 billion with an annual growth rate of 30%. And there are many opportunities right across the UK for companies that are developing innovative products and services, and we are focused on innovations that can have the biggest impact on our ageing society. And in healthcare and life sciences, these include areas such as prevention and diagnostics, managing the common complaints of aging, such as eyesight or hearing loss, incontinence or foot problems, then rehabilitation and medtech, mental health and well-being, dementia care, age-friendly homes, and longer-term care. And a couple of examples on how we are delivering on the industrial strategy are the recent opening of the National Innovation Centre for Ageing, based in the northeast of England, and the launch last year of the Industrial Strategies Challenge Fund for Healthy Ageing, which is a £98 million fund aimed to stimulate well-designed innovations to support healthy ageing. So DIT is happy to work with you on developing your opportunities in the UK. And I'll hand over to my colleague, Dr. Neil Ebenezer, our medical technology specialist within the team. Over to you, Neil.
Thanks very much, Julie. So as Julie's mentioned, there's a number of areas in terms of aging where life science is going to be really crucial. So alongside pharmaceuticals, we have medtech, and it addresses a lot of those challenges that Julie outlined. So my role today will just to talk to you a little bit around the medtech technologies, say what we mean by that, and give you something of the UK landscape in the medtech area and how we can support companies coming into the UK. So in terms of medical technologies, we're talking about medical devices and diagnostics mainly, so in vitro diagnostics or in vivo diagnostics, imaging and so forth, as well as software that might be related to both of those areas. And we have a very vibrant UK medical technology sector, so up and down the country. So you saw a picture of the country from the HN slides, which focus on England mainly. But when you look at the devolved administrations, those are also very vibrant for medtech. And in total, there are over 4,000 businesses, 130,000 employees, with over 26 billion turnover in the UK. So any company coming into this comes into a very rich landscape. So where you'll have a ready-made supply chain, and you can actually access new markets as well in terms of the NHS, which you've heard quite a lot about. The UK also competes quite globally. So the life sciences sector is highly competitive, and countries work hard to promote their offer in order to attract foreign investment. And for the UK, we have a corporate tax rate of around 19%. And in Forbes ranking, we're ranked #1 in terms of ease of doing business. And so for the medtech area, we're the third largest in Europe behind Germany and France. And so some of the dedicated support infrastructure, yet again, colleagues from the HSN have described the good work that they do in supporting companies coming into the UK to access the NHS, as well as looking at some of the academic contributions. But we have quite a vibrant area in this part where there are a number of other entities, and I'll touch on that a little bit later, like the National Institute for Health Research. But we also have a pragmatic regulator in the MHRA. And if needed, we can talk a bit more about regulation. We also have very detailed health technology assessment, looking at how we can look at value for medical technologies and the access of that in the community. So alongside these sort of regulatory guidance agencies, we also have, as I said, the NIHR. And they have a number of, there are 11 what they call MICs. These are medtech and in vitro diagnostics cooperatives. And they will focus as centers of expertise and excellence, bringing together patients, clinicians, researchers, and commissioners, and industry to catalyze the development, evaluation, and adoption of medical technologies into the NHS. So for instance, in Sheffield, you'll have the NIHR Devices for Dignity, looking at, as a medtech cooperative. In Cambridge, the NIHR Brain Injury MedTech Cooperative. And so up and down the country, we have 11 of these centers of excellence. And alongside that, we also have Health Data Research UK research hubs. And there are 7 of these dotted up and down the country. So in Birmingham, for instance, we have Insight, which is looking at working with industry. So you have Google DeepMind, Genentech, as well as Birmingham Hospital and University, as well as Moorfields Eye Hospital, a world-renowned center of excellence, as well as the charity sector, coming together to look at how you can deliver ophthalmology services better for a community. And this talks very much to that aging population, the challenges we face with an aging demographic and the rise of the incidence of the rise of age-related macular degeneration. And this is one of the specific targets of that HDR UK research hub. So you can see that this is quite a vibrant area for medtech in the UK. And we're supported by a number of accelerators and incubators up and down the country. So any company coming in with a specific technology, we can find a natural home for you to develop your product further. And through that, you can also get access, if you're settled in the UK, access to funding through the NIHR, through programs like I4I, or as Julie's mentioned, through Innovate UK. So if there are companies that are interested in coming to the UK, please get in touch, and we at DIT are happy to help. I'll pass you back to William.
Excellent. Thanks very much, Neil. So I think you very neatly summarised a lot of the support that the department can offer. And we are not just for the sort of medtech and healthy aging sector. We are able to offer a broad range of services for incoming investors. Be that sort of making connections through the UK ecosystem, facilitating introductions to local enterprise partnerships to sort very practical things like office or lab space or access to skills. We've spoken about identifying innovation or research grants, but also financial modelling to demonstrate the competitiveness of UK locations. I'm very much looking forward to taking your questions presently in the Q&A session, or further down the line. I'll make sure to share my details in the chat. So I'll pass it back to Michael now. It's been great to be able to talk to you today.
Great, thanks so much, Will, for that, and also thank you to Neil and Julie. I think what I do want to say. I know we're coming up on the hour. We have allocated time for Q&A for anyone who has it, but I do realize some people may have to head off. So I'll just quickly say that first of all, thank you to all the speakers, and I want to point out you can't overvalue the importance of having these kinds of connections and access to these kinds of resources and supports when entering a new market. I think what it does is for those who maybe would not be in a position to easily enter a market or even consider it, you can see that the supports are there, the willingness to help is there. From all fronts, including the HSN network and the Department of International Trade. And I think that's great. That's greatly appreciated. And that speaks to the strong partnership that we have with the UK, but that we're looking to build here between our AgeTech community, AgeWell, and the HSN and the Department of International Trade at the UK. So thanks so much to all of you for speaking to that. I do want to point out to the audience that like I said, if you have questions, you can still enter them, but we will also happily take questions by email or otherwise and pass them on. I know some of the presenters have provided their contact information in the chat, but please do feel free to reach out to us as well at AgeWell to do that. I will share the slides as well as a recording of the presentation afterwards, and I'll also give you an opportunity, like I said, to speak to what areas of interest you'd like covered in the future. I know we had a lot compressed in these 2 hours, and especially in this hour, and there's probably a lot more you could gain and understand if we gave each of the speakers more time. So please do indicate where your areas of interest are. And again, thank you to Will and his team, to Nigel, Nev, and also I know Susie Al-Hassan is here from UCL Partners in the background to manage any questions. So thank you to her. If anyone would like to stick around and ask a few questions, we did allocate at least 10 minutes for that. So please feel free. Otherwise, I'll also say thank you to Maria Ponte from Startup Canada for helping us make this happen. And in the meantime, we will stick around a little bit to hopefully answer any questions you may have. And to look forward to seeing all of you at a future date. So just wait a little bit, see if there are any questions that come in for the live panel, but otherwise I think we'll have to pass them on and get answers to people in the future. Okay. So I think it's safe to say that that we're good with the questions and we can close it up. I don't know if Maria, if you want to come back on just to make any closing remarks, but for my part, thanks again to everyone attending. We look forward to hosting more events like this in the future and helping connecting you with the resources and thought leaders and ways to help you grow and succeed in the AgeTech market. So I'll hand it over to Maria and leave it there.
Yes, thank you so much, Michael. I was just writing in the chat. Thank you everyone for attending. Thank you for your time. This has been a great community mixer. Thank you for all of the academics, experts in sharing your knowledge with the Canadian ecosystem in this field. We are very honored again. And well, no, thank you. Thank you for everything. If you want to connect to Startup Canada, our website is startupcan.ca. And hopefully we will meet in another community mixer next year.
Great. Thanks everyone, and all the best.